One second, my recording starts now. Hello guys, this is Bharat from 108 Bespoke. I'm glad that we joined in by Dr. Dhwani from Ahmedabad. A small introduction about Dr. Dhwani. She's a consultant dermatologist and cosmetologist. She did a post-graduation residency from BJ Medical College, Ahmedabad. She has a specialized aesthetic medicine from American Academy of Aesthetic Medicine, USA. She founded her clinic, Derma Wellness and Aesthetic Clinic, in the year 2014. And since then, she's been practicing clinical dermatology and cosmetology in Ahmedabad. She's also a consultant at the Zydus Hospital. She does a range of cosmetology treatments, including laser hair removal, acne treatment, body contouring, anti-aging procedures like Botox, and many more. She's a member of the following associations: Indian Association of Dermatology and Venereology, American Academy of Aesthetic Medicine, International Society of Dermatology, Cosmetic Society of India, and European Academy of Dermatology and Venereology. Hey, welcome, Dhwani. Thanks a lot for joining us.
Hi, Bharat. How are you?
I'm good. How are you doing?
I'm also good. Thank you for inviting me in this talk.
Thanks a lot. Yeah. So, Dr. Dhwani, how has things changed for you after this pandemic, after Corona hit?
It has been changed tremendously because we are not calling any patients to the hospital or the clinic because it is very scary in the Ahmedabad right now. Okay, so
Right.
I'm just advising them the home care treatment, and as far as it is possible, I'm advising them to treat on the phone only.
I can understand. Yeah. And Ahmedabad is pretty scary. The numbers, at least Bangalore, that way we have lesser numbers. But Ahmedabad, the numbers have been growing,
Yeah. Too much.
So I can understand. So, but what happens? What if any client wants some sort of physical treatment? Can they still come to your hospital or no?
No, see, if it depends on the things, because I am treating both the things like dermatology and the cosmetology. So if they require cosmetology treatment, then of course, no. Depends on the, duration of the treatment. If it is longer than the 15 minutes, 20 minutes, then there will be constant exposure for me and as well as patient also. So it goes vice versa also.
Right.
So then I'm not doing such type of treatments which requires 15 minutes of the duration, more than 15 minutes thing. But there are a lot of cases that they have actually dermatological problem. They are actually the disease.
Correct.
In that
Correct.
I have to admit them to the hospital also. So it depends upon the disease. If it is cosmetology, then purely no. But if it is a dermatology, then yeah.
I can understand. Yeah, because I think with the cosmetology, they can postpone it. It's not emergency.
Yeah, exactly.
Yeah. Pretty cool.
But still now we are coming into the routine now, because these things are going to be quite long. So like many procedures are less than 15 minutes duration or 20 minutes duration, then we are offering the treatment to the patients now.
I can understand. So another question that I have for you is, now, for example, with this whole coronavirus thing, and so you must be having these safety precautions. So what are the safety precautions that you're taking in your clinic or in Zydus Hospital if any client walks in, or a patient walks in?
So whenever as soon as I reach the hospital, first of all, I wear the scrubs. I do not wear my clothes. So first of all, I wear the scrubs, then I wear the gowns and that PPE kit, then cover my face with a mask, cap, and the that entire shield, helmet type of shield thing, and the gloves. And if possible, I see the patients at least 3-meter distance. But sometimes I need to touch the patient and I need to say the things. Then at that time, of course, I have to go to closer to the patient. But I would prefer to see the patients at if I don't have to touch, then I am seeing them at the 3-meter distance at least. And I don't allow any relative to enter in my room. We don't purely work on the appointment basis, so there are no lot of rush in the waiting area.
Very nice. So it's purely appointment basis then, in the sense.
Purely appointment basis. Generally, I know I do not call the patients in my waiting area only. I schedule my appointments in such a way that, once finishes and then the second come directly from their car only.
Exactly.
So I, ask them to, if like previous patient takes so much time, then I ask the second patient to sit in the car, and once I finished my first patient, then I, ask them to come directly from the car only.
Correct. I can understand, because with this whole craziness, it's always better to make sure you have enough time between patients. And so no overlapping of patients whatsoever. So that's pretty cool. So this gets us to the second segment. I just have some very specific questions that I wanted to ask you. So what exactly is dermatology? For people who listening to us, they might consider it a very serious profession, that only if you have a problem, that's when you need to go to a dermatologist or something like that. If you can just give us a small overview.
There are a lot of problems and lot of diseases, but which we are commonly encountered in a day-to-day thing. They are the acne, like pimples, breakouts, pigmentation, scars, dark circles, hair fall. Lot of allergies problem are very common nowadays due to pollution in the environmental changes. Dry skin is very common in this COVID due to lot of use of hand sanitizer and the soaps and detergents and.
Correct. I can understand. So why is it important for someone to go to a dermatologist on a regular basis?
So so everyone likes good and flawless skin. Even if you like, I do also like. So it's a feel good factor. It boost up your confidence. And when the treatment is available, then why should not we go for the cosmetology thing? Dermatology, everyone is going. If someone is having lot of hives and allergy, then he or she must have to go. But if someone is having pigmentation or scars and hair fall thing, then if treatment are available and it is you can manage at your home, then of course, why should not go to the dermatology?
Correct. So what is the exact difference between a dermatology and cosmetology? It's for people who joined us.
Dermatology covers both the thing, cosmetology and the dermatology, but mainly the dermatology deals with the diseases. There are a lot of diseases that general population is not aware of. So we are seeing such type of patients like autoimmune disorder, connective tissue disorder, allergic, the skin problems associated with kidney problems, diabetes, liver problems, thyroid. So there are a lot of diseases. So those cases we are handling like hypertension patient, blood pressure patients, or diabetic patients. So those patients have to see the dermatologist on regular basis. And cosmetology generally includes the like well-being and flawless skin and the clear skin and good glowy skin, the related anything related to good skin, and the procedures related to all these things are called the cosmetology.
So what I understand is cosmetology is not an emergency kind of a procedure.
True.
Dermatology can be either emergency or not emergency.
True.
Correct. Oh, sounds good. So I think most of the film industry, or you see the celebrities and things like that, they fall into cosmetology in the sense when they're looking to enhance their looks.
Yeah, so it's a beautification treatment. So each and every individual is looking good only, but we can still enhance individuals' beauty. We can still make them more beautiful. We can enhance their we can highlight the features and all.
Correct. True. Sounds good. So now a quick question on how you provide consultation online, right? Is there a limitation, in the sense, if there's somebody who's outside Ahmedabad or even outside India who wants to take your services of consulting, can they take your services, or they have to be there physically or at least present in Ahmedabad?
No. It's as I told you, depends upon the condition. It's there are some conditions in that I have to touch the patients and I need to touch the particular diseases, and that in that area, if someone is having boil or abscess or something, then I need to see how deep it is, and like that. In that case, of course, their presence is required. But in non-emergency conditions, we can treat them remotely only. So yesterday only, I did teleconsultation with one of the patients in the US and one of the patients in the Tanzania. And today morning I did 2 consultations from Rajasthan and the Madhya Pradesh. So all that Patient sent their details me on the WhatsApp, their photographs, their investigations, and then we did the video call. So it is
Correct.
manageable only.
Very cool, very cool. I think that's really cool, that people don't have to be there physically in
Yeah,
today's age
exactly.
where,
I don't have much clue about the African countries and all, but in USA though they are not getting appointment only because dermatologists are
wow,
strictly saying that this is not emergency condition. You just come after 2 months or 3 months or so. So and it's
wow,
someone just want to kickstart the treatment and don't want to wait for the 2 or 3 months, then um, we can go for the
correct.
teleconsultation.
Correct. Sometimes you just need advice, right? You're just scared
Right,
about
right,
something
right,
and you
right,
need that
right.
immediate advice. You can't
Yeah,
wait for 2 months to just get advice, right?
exactly.
Yeah. Yeah. So that's pretty cool. That's pretty cool. I think this is good uh, to hear that, people can take your appointment online so that there's an online consultation where they can take your services. That's pretty cool. Now, one quick question that I have is how is, obviously you did touch up that thing, online and offline consultation is, the difference is that for offline consultation, the person needs to have some sort of uh, I wouldn't call it disease exactly, but some sort of treatment that's required that needs physical attention, right?
Right, right.
In online, it might be allergies or something which even photos can tell you the story,
Yeah,
so they
yeah,
don't have to
true,
be there.
true.
But then are there a lot of differences between such things between men and women, and how do you differentiate them? About what are the different skin types, etc., between men and women.
No, if we see disease perspective, then there is no difference between man and the female. Okay.
Okay, okay,
But if you want to take a routine skincare thing at the home, then
correct.
yeah, there is a lot of difference.
Okay. So you say the cosmetology part, there
Cosmetology,
is
yeah, and
quite a bit of
if I
difference.
have to do the laser thing and like
Correct,
photofacial
correct,
thing and the other
correct.
clinic based procedures, then